Hello and welcome to Your New Jersey. I'm Lisa Marie Falbo. On today's show, we'll be speaking with Holly Strelzik, founder of the Center for the Heart. Holly is an expert in end-of-life care and grief support and has helped many around the Garden State navigate these emotional journeys. But first, I am joined by Dr. Dustin Riccio, President and CEO of St. Joseph's Health in Paterson. As he marks his first year leading the organization, Dr. Riccio will share his journey from growing up in New Jersey to becoming a physician and healthcare leader. Doctor, welcome to the show.
Thanks for having me, Lisa.
Well, the last time I was with you was at the Tom Coughlin J Fund Gala at MetLife Stadium, and it was a wonderful night, and it really just brought home a lot of different missions. And I know the J Fund is so important to the Children's Hospital. But before we get into all of that, congratulations on 1 year as CEO of St. Joseph's Health.
Thanks. I appreciate it very much. It's going great. I started back in this role back on January 8th of 2024, and it's going very well. Great to be part of such a wonderful organization, mission-based, community-based organization like St. Joe's.
And I know St. Joseph's is so important to the fabric of the greater Paterson community. So I know it's very important for you to make sure that it keeps growing in that direction.
Yeah, for me, taking over this organization, an organization that's been around for 165 years, founded by the Sisters of Charity St. Elizabeth, there's a burden that goes along with it, right? Going back 165 years prior to me getting here. And then when you look at who we are for the community, the healthcare that we provide to the immediate community, the organization that we have at Wayne, Totowa as well, and how we expanded out over the Passaic County and in a greater area, it really speaks to the fact that this place is founded in the mission, founded in community, and I have to keep that going, and I'm looking forward to taking that on.
And St. Joseph's, it's independent. You're not part of one of the big hospital systems here around the Garden State. So how do you raise funds to keep operations going?
Well, I think it's a very important point. I appreciate you bringing it up. It's one of the reasons that I looked at this organization. I was very happy when this opportunity came forward because there's not a lot of independent health systems that are out there in the United States, let alone within New Jersey. And when I looked at it, what I saw was a smaller health system, smaller than some of our competitors in the surrounding region, that was really not just surviving, but also thriving. And I saw a lot of opportunity with what the organization had already created. And what I wanted to do was just build up the work that's already been done and then expand some of the great culture that we've had here so that people can know who we are, what we do, the mission that we serve, and that we really want to expand outwards from Paterson, Wayne, and from Totowa.
Talk about some of the key features of the hospital, like your children's hospital, your emergency department.
Yeah, so great aspects of our Paterson campus here. From a Paterson standpoint, our children's hospital was the first children's hospital in New Jersey, and it goes all the way back to Sister Jane Brady, and I think that's a name that a lot of people know within healthcare. It's a lot of people know that within the state of New Jersey, and she really did a wonderful job in creating that children's hospital here at Paterson, and it continues to this day. Interestingly enough, I was able to actually participate in the 50th anniversary of our NICU here at Paterson, started in 1974, just a couple of years before I was born. And we got to see the graduates actually come through and celebrate the work that we've done here for them. And for me, it was actually a very touching moment to see that. So from a Paterson standpoint, that is our children's hospital. From an emergency standpoint, our emergency department in Paterson is one of the busiest. It's one of the top 10 in the country every year, averaging somewhere around 130,000 patient visit volume. As an emergency physician myself, and growing up in New Jersey, I recognize what that means. It's a very challenging environment, but it speaks to the community that we serve and the necessity of providing great quality care within that community.
You kind of just stole my next question. You touched on your background, and I want to educate our audience. How did you become CEO of such a prominent hospital?
Yeah, so I started my journey. I grew up in New Jersey, started down the shore, and really just, I love New Jersey from day one. And I wound up attending college in Pennsylvania where I met my wife, and we actually wound up getting into the same med school up in Syracuse. And so I wound up spending the last 15 to 20 years depending on how you count it, up in Syracuse and Rochester, where I did my medical school, I did my residency, and then really raised my kids there. And about a year and a half ago, 2 years ago, I opened myself up to some additional opportunities. I was really hopeful to go anywhere in the country to really look at what it meant to be a CEO of a health system, an independent health system, which for me is something that I've always wanted to do. And one of the recruiters called and said, Dustin, we have an opportunity for you in New Jersey. Now, when you look back at that time, and as I said to you, we were open to anything throughout the entirety of the country. When you say, hey, Dustin, would you like to come home again? That's exactly where I jumped at the opportunity. And from a New Jersey standpoint, it really married with what I wanted to do in the future. And then when you look at the organization, faith-based, mission-based, community-based organization that means a lot to the surrounding communities, I jumped at the opportunity, and I really was lucky enough to get through the entirety of the process, and very appreciative for the work that the board and the sisters did in bringing me on board.
How does your background as a physician help shape your approach to leadership?
I think it's critical, and that does not take anything away from all the other hospital administrators that are out there. But someone just gave me a fact the other day that I am the only independent health system CEO who is an MD, there is one down at Cooper as well, who's co-CEO down there. But I think it's truly critical to being at the administrative and the executive level and having physicians and clinicians in those seats. From my perspective, I spent a lot of years doing night shifts, working with the team in the emergency department, really fighting the fight. So there's an understanding that I have from a background standpoint in what it takes to be on the front lines, what it takes to be in a high volume emergency department, and also an understanding, especially within the emergency department, that we talk to everyone. We talk to the surgeons, we talk to the family practice docs. We are entrenched within the environment, knowing what throughput looks like within the hospital. We work with all the colleagues from a support service standpoint in the hospital as well. So I believe that there is an inherent knowledge that I have as a physician from the medical training that I have, but also from the shared experiences that I had within the emergency department that you can't replicate. And I'm hopeful that the work that I've done in the past, the knowledge that I've created with those shared experiences is going to help elevate this organization even further.
Talk about the other part of your job, though, being out there in the community. Like I mentioned, we really got to connect at the J Fund event. You're going to events all the time. You are now the face of St. Joseph's. How does that fit into your life?
Yeah, it's a critical component because I think that one of the things that we have done well here is we've created great quality care. And we have surrounded ourselves with partners who help us really do a great job here within Paterson, Wayne, and in Totowa. Really, what I would like to do is exactly what you're describing. I want to make sure that I am, as the face of St. Joe's, out there within the state, showing people that we've got great quality metrics at this organization, right? Leapfrog A at our Wayne Hospital. We are Leapfrog B here at the Paterson campus as well. And I want to really get that out there. We are an incredibly humble organization, and that will stay that way for as long as I'm here and beyond that time. But I want to really amplify our voice and let people know who we are and what we do well. And as a function of that, yeah, it means spending 3 or 4 nights out a week. It means getting out in front of donors, out in front of legislators, out in front of our competitors and partners, and making sure that they know who we are, what we do, and what the direction we're going is. And I'm very appreciative to be in the role to do that.
Well, you have a lot of irons in the fire. I know that you're launching new technology with 3D mammography. You're utilizing AI now. Talk about some of these new modalities.
So from a mammography standpoint, we are building that up, and actually that's a new launch that we have most recently at Totowa. In regards to AI, it's a very large initiative that is out there. On the front end, what we are looking at is for convenience from a consumer standpoint in getting the results that they need in a very timely fashion, making sure that they are appropriately delivered to them. And on the back end, what we're also looking for is from a physician standpoint, that they have the appropriate diagnostic tools available to them with AI, and also ensuring that they have a convenience in the work that they're doing to get it done quicker so that they can actually provide more care to our patients.
In the community that you're serving, it's so important to get the word out there, you're accessible, and that early screenings and detection matter. How do you get the word out?
I think this is something that we do through one, our physicians. What we want to make sure of is that our physicians become the face of this organization within the community. And I think that is really built around trust. What we want to make sure is that they trust from a quality standpoint that the people that we are putting in front of them have their best interest in mind, and that the verbiage that they are using allows them to be trustful, knowing that when you come to me, you are going to get care that is quality focused and in your best interest. And from a screening standpoint, what we don't do as well as we need to within medicine is to create a preventive approach to that. And what we want to do with our primary care, we want to make sure that those individuals are quarterbacking that experience for everyone throughout the entirety of our health system. And then creating screening, whether that be through colorectal screening, whether that be through mammography that we already discussed, so that we can prevent any untoward outcome in the future. But it really is, it's founded in trust. It's creating a primary care network that people use for their quarterbacking. And in my opinion, that is the path forward for all of medicine, not just at St. Joe's.
You have such a beautiful mission over there at St. Joe's that it's so easy for viewers to get involved with all that you have going on. You have the best events, including one of my favorites, and yours, Fashion with Compassion. Tell us your calendar coming up in 2025.
Well, I think the easiest way for people to get involved is really even from a volunteering standpoint, right? What I say to people is time, treasure, and talent. And from a time standpoint, if anybody wants to be involved within this great mission that is founded by the sisters, it is really just volunteering their time, whether that be at Wayne, that be at Totowa, or here at the Paterson campus. It really is about serving the underserved. And in addition to that, there are people that have time and also have treasure and the willingness and the want to give, whether that be through a great experience that they had here at St. Joseph's or just an experience with healthcare or wanting to give back to the community. And what I would say is we are happy to talk about what our foundation looks like. That is Rob Budelman. He is our foundation VP, and the work that he does is truly amazing. And I would connect with any aspect of our foundation in that regard. And then in addition to that, once you're in that network, what you said, Lisa, is absolutely correct, right? We do a number of different events throughout the year that highlight the different services that we offer and really highlight some of the care that we give. The Fashion with Compassion, probably, it was the first time I did it this year. It was an amazing, amazing event where we had the kids who came through our children's hospital, whether that be through a surgical perspective, a primary perspective, the care that they received, and they walked the runway with me. I actually got a chance to walk the runway with my niece, who was born here at St. Joseph's as well. And they walked the runway with us, highlighting the doctors and the care that they receive at St. Joe's. Fashion with Compassion is a great event. We've also got multiple, we talked about our friend Roman Obin. Roman has done some of the work from a golf perspective in bringing some of the NFL players out to St. Joe's, introducing them to both patients as well as our staff in raising money for the organization. And then we also have our gala, which is our premier event that just happened about a month ago. And that was our biggest fundraiser for the year. We typically will pick one aspect of the work that we do, highlight that, and then raise money for that throughout the year, as well as at that gala. Those are three ways that I would say are critical for the philanthropy, which is a critical component of our success, and the ways that people can give.
Hey, philanthropy is fun, and St. Joseph's definitely knows how to throw a great party. Doctor, where can people find out more about St. Joseph's Health?
I think the easiest thing that people can do, Lisa, is they can go to stjosephshealth.org and they can find out about all the great work that we do. They can also find a physician and go to the foundation page as well.
Doc, thank you so much for coming on here. We'll see you at your marquee events later this year.
Thank you, Lisa. I appreciate the time very much. Have a great day.
Now we're joined by Holly Strelzik, founder of the Center for the Heart, an end-of-life doula, grief specialist, published author, and Reiki Master. Holly, thank you so much for being here today to share your story.
Thank you so much, Lisa. Thanks for having me. I really, really appreciate this time.
Well, I was just blown away when we met last month at the Let's Talk Women's Health and Wellness Content Day ahead of their big March 29th event at NJ Pack. I am just so into your journey into becoming a death doula, and I think it's just so important for our viewers to know that a person like you exists out there in the most trying time in anyone's life. So talk to us about your journey into this career.
So, I've been doing the work for about 14 years. It started after I had a health crisis, which was a brain aneurysm, and it was all about, for me, just being able to give back. At that point, I started working in the hospital, working with a hospice, working with a couple of hospices, and I saw that I was really at ease, comfortable, and peaceful with death. As a result, I started all the trainings, and back then, I mean, this is a while ago, so it was about 1,000 people at that point that were death doulas. Now there's tens of thousands, but throughout that journey, I just started, exploring more, going into a lot of spiritual trainings, a lot of, there's a magnificent certification process, and that really resonated with me. And at that time, I took it and just started, hung the little journal, you know, started with doing the work, just word of mouth. And it was so unbelievably natural for me. Coming from, corporate America, I never thought in a million years I'd be the person to be doing this work. I just really delved in and started communicating and reaching out and networking and educating people on what death could look like. It can be a beautiful, peaceful thing. And then when my husband was diagnosed during COVID with Alzheimer's, that's when I launched the nonprofit. That's when I knew how very important it was for people to have information, to have resources, to have support, because honestly, I can't imagine this journey without that. It was powerful. So here we are. We're working a lot with a lot of different organizations. We're partnering with hospices and looking at hospital systems to be able to bring our work and our doulas in, both, fee for service and as a nonprofit. But for me, I don't ever want to turn anyone away.
It's just incredible, the journey that you've been on in becoming an end of life doula. What does that support look like?
Oh, people ask a lot, when should we contact you? As early as possible, because at the end of the day, it's a hard conversation to have. No one wants to talk about their own mortality. But look, we live our best life now, and we want to continue going through to the very end with exactly what we want. We have a lot of clients that call us where the adult children are living on the other coast and they want their elderly parents to be cared for or just watched over. And as time goes on, that changes. And so then we're there consistently, whether it's getting the aides in, responding to the crisis calls that come in from the hospital, because now the 95-year-old is in the hospital. So someone has to be there to make sure that they're advocated for. And then we transition them out, get them back into their home or into wherever they're living, whether it's an assisted living, an independent living, etc., and then coordinating everything that they need. Then there's others where we get a call, someone is getting ready to be discharged. They no longer, want to undergo any type of treatments for whatever illness that they're going through. And they and their family members have decided, okay, this is it. We want it to be as beautiful as possible. And so that's what we do. We put it together. We listen to everything that they want, whether it's the grandmother who wants to have, her 5 grandchildren with her, next to her in her hospital bed, painting and coloring and watching TV and enjoying, cookies, etc., etc. That experience brings so much peace and solace to the younger generations, which is key. That's another scenario. We work with just a lot with the elderly more in their companionship as they start to shift from, okay, now I need to downsize and I don't know what to do. Can you connect me? Can you help me coordinate? And we're right there. And again, it's to take them through the entire experience, the experience, the journey, because at the end of the day, if they have no one close to them, we're there to support them. There's a lot. And we meet people wherever they're at, meaning if they're in the hospital or if they're in a home or if they're at their own home. So we go wherever they need it throughout New Jersey.
You are also a Reiki master. So how does Reiki help in end of life?
To me, Reiki is peace. It's not spiritually based, it's not religiously based. From a physiological standpoint, it is basically calming the central nervous system to just allow everything to flow as naturally as possible so the body can heal or whatever the body needs, working on a lot of anxiety, depression, etc., etc. And in an end of life scenario, what I've seen a lot is, like I said, we've had some very young patients, and the families have requested that. And that's all they wanted from our doulas. And that's what we've brought in. And what it's done for the individual and their family is to create that very physical harmony as well as peace for all the individuals in the room.
Let's talk about medical aid and end of life care in the state of New Jersey, because it's a hot topic right now. What are your thoughts?
It is. We have clients that are electing medical aid and dying. As end of life doulas, we meet the client where they're at. This is their wish. They want to go out of this world in a peaceful, comfortable way on their terms. A lot of times I get the question, is this considered suicide? Will my family members be able to collect my insurance? It's not considered suicide. And yes, the families will receive the insurance. It's a hot topic because, you have the whole religious viewpoints. We don't bring that to the table at all. It has nothing to do with our own personal beliefs or wishes or anything else. It again, as end-of-life doulas, our goal is to make sure that these individuals have exactly what they want. Because, think about it. They can't control anything else. They're getting ready to go through tremendous pain or suffering, and they don't want family members to witness all of that. They want it for themselves.
And I'm so happy we're having this conversation, because talking about this and grief, it's so hard for a lot of people.
Yeah, absolutely. Absolutely. And, with the cases, with specifically with medical aid and dying is, you find a lot of times the families around the individual don't want to hear of it. They don't agree. And that makes it even harder for the individual when all they want is to control their own end. The grief surrounding the platform, and a lot of times what you find is the individual in the bed, the one that's sick, is okay. They're peaceful. It's everyone around them. So we spend a lot of time making sure that we're taking the temperature of everyone in the room. Are they young? Are they little kids? Are they, siblings that there's a lot of unfinished business or open emotions that need to be clarified in order to work through this? So we're watching it all. And then depending on the scenarios and depending on what they need, we have resources, whether it's just education or if it's really concrete grief processing. So they aren't going to house it. There's a lot of stuff that we carry that if we can just work through it, it makes all the difference in the world as far as then trying to navigate a death and navigate someone else's end of life, as from the viewpoint of the family member. There's so much to talk about.
There really is. And that's why I wanted you to come on here, because I instantly felt such a connection to you. And I mean, you're just a wonderful soul. You mentioned that you work with numerous nonprofits and hospices around the Garden State, but you also have a nonprofit, Center for the Heart. What is that?
Center for the Heart is end of life and grief support services. We are a fee-for-service business, as well as the nonprofit was created because I never want to turn anyone away, and I never have. If someone needs our care, I was just presenting to another hospice, and the goal is to be able to provide our services. But if they ever come across anyone who has no family, no friends, and there are cases like that, a lot of those cases, they need the support. Hospices cannot be there 24/7. We could if we needed to be. And that's why there's a nonprofit. If you cannot afford it, we're here. Now we're launching with a lot of programs, pitching to hospital systems, pitching to assisted livings, pitching to hospices to partner with them, to have doulas on staff. So even the hospices can give a complete and total package of care. Because you know what the numbers are. The numbers are growing astronomically. Look at the baby boomers. Look at all the diseases that are going to constantly increase, and the thought of not having support, it's shattering.
Absolutely. Well, I am a big advocate for doulas at the beginning and end of life.
Yeah.
They're so vital. Holly, thank you so much for taking the time here. How can people learn more about you?
They can go to the website, www.centerfortheheart.org, or you can call 908-503-C4TH. Thank you so much, Lisa. I really appreciate it.
I appreciate you, and we'll see you on March 29th at NJ PAC for
yeah,
Let's Talk Women's Health and Wellness. Can't wait for that.
Yeah. Thank you.
Thank you for joining me on another episode of Your New Jersey. I'm Lisa Marie Falbo. We'll see you back here next week.